Welcome to a nutty adventure exploring personal growth and wellness, breaking down the stigma around mental health along the way. Let's dive in because now it's time to show me your nuts.
Good morning, everybody, and welcome to Show Me Your Nuts. Welcome back to Freedom Month. So last week, we busted out the I'm not ready myth. And today, we're going to put our feet on the ground and we're going to turn freedom into action through advocacy. This word, this concept, this entirety of the word advocacy has a huge place in my heart. To me, as a social worker, and I think I was a social worker before I went to school and became a social worker, advocacy is at the heart of our freedom in the country we live in the United States. Advocacy and being able to speak and come together in discussions and figure out what we're doing as a group of people, as a country, it's at the center of everything we should be doing. But advocacy to me also speaks to social justice. It speaks to doing things that do no harm in the world and that do good for for all of us. So I'm deeply attached, we'll call it that, to today's topic. And I'm super excited. I'll tell you why in a minute. But freedom, it's not just personal. Freedom is collective. We gain our freedoms by respecting each other, and we give our freedoms by being responsible to being respectful to each other. When we advocate for any topic, we create freedom for ourselves and for our communities. And, given that Show Me Your Nuts is about reclaiming the word nuts and freedom and advocacy for mental wellness. And when I speak of mental wellness, I mean all of the things that have to do with our mental well-being. And I try to use the word mental wellness as often as possible because to me, that we each have different ways of being mentally well, and we each have different spectrums of being mentally well. And that's, some other people may say mental illness. Well, to me, it's a spectrum of where are you at any given moment in your mental wellness. Not this person is different and they're not as good as or whatever. And that's why the reclaiming nuts is just really important to me, because to me, I want that message out in lots of different ways. And today it's number one through advocacy, but also through the deeper understandings of what mental wellness is. So also we're talking about action and what actions can we take as individuals for ourselves, for our families, for our friends, for our communities, for society on the whole, towards that freedom and advocacy for our mental wellness. So, since we're talking about action, and just to wrap us back to last week about the I'm not ready myth, putting action in place, tell me in the chat, what action have you been wanting to take but you haven't yet? That you might have figured out that you're ready, but you haven't actually taken the action. And I'm gonna peek at the chat. I may not be in the chat as much today, but thankfully the Breakthrough Show Network's got my back. And advocacy is a freedom, but we may not realize, we all may not, but many may not realize it. Many may not realize it, and they don't. I think we for a long time, we lost our social civic acumen or understanding that we are the process and we are a part of the process and we should be part of the process, that we are of the people, for the people, by the people, and that takes all of us as the people. It's not just somebody giving us or telling us what we should do. It's that we need to be active in that thing in many ways. There's lots of different ways to be active. Going to the Capitol is definitely one of them. And I and if you haven't ever done that, try it once. Just find something that means something to you and try it once, you know? So speaking of trying something once or trying something for the first time, today is the first time we have an official invited guest to Show Me Your Nuts. And I am super excited. I am super excited to welcome our first official guest to Show Me Your Nuts, Simon Messmer of Mental Health America of the Heartland. Today's wisdom comes from Simon. He is the Vice President of Mental Health America of the Heartland. Mental Health America of the Heartland is a national organization that works, their underneath their mission is basically advocacy and education about mental health. Just back secret, I am a board member of Mental Health America of the Heartland. That's how Simon and I met years ago. And we have an interesting back and forth journey that we've followed each other and learned from each other. And I'm just super excited that he is my first official guest. So welcome, Simon. Welcome to the Show Me Your Nuts living room.
Thanks for having me. It's also a first because this is my first sort of performance as the Vice President of Mental Health America. So we'll see how it goes. We're both doing new things today.
Yeah, well, and I think as a board member, and I'm not directly your boss, but I'm one of your boss's advisors. That I would not have invited you here had I not already believed in you. So let's
thank you. You're very kind. Part of the reason I like you so much.
Yeah. So
yeah, I am excited to talk today about advocacy. I was hoping we could talk a little bit about stigma. I know that's a thing that you talk about on all of your various shows. And I'd love to have a conversation about that today too. But we'll see how it goes.
Well, why don't we start, if you don't mind, let's start with maybe telling us a little bit about your journey on your path to Mental Health America, and then maybe like your initial path to Mental Health America, and then what has happened since then, because I know it's been a journey there as well, right?
Absolutely. Yeah, absolutely. So I started at Mental Health America in about 2004-ish as an intern. Over the years, there have been a lot of folks that have come through MHA as interns of various kinds. Were you here as a public health intern at one point doing something?
I was, yeah. Yeah, so I started on the board probably around 6 or 7, 2006 or 2007. And then in 2011, I was a public health intern when I was working on my second master's degree. Good call. I forgot about that.
Yeah. You took me to a powwow one time, which is strange but true. We were doing depression screenings.
Super strange but true. Yeah.
It happened, but it was fascinating.
Yeah.
Fun to watch.
We were doing it was through the American Indian health education. Well, we had multiple names, but it was the American Indian Research Team at KU Medical Center. ARIA was the name of the organization, and we had we were doing health screenings at the powwows, and we had a team of largely American Indian team members, many of whom working on or are working with their master's degrees, and I was working on my second master's degree at the time in public health, and we were doing health screenings. And specifically, of course, I was, most interested in American Indian mental health, which is a cool precursor, because later this month, so 2 weeks from today, we're going to have a guest on. We're going to have a guest from my nation, and we're going to be talking about American Indian mental health specifically.
Oh, that's awesome. I'm making a note so I can come back.
Yeah. That one's actually going to be a pre-recorded show, but it will be on 2 weeks from today.
Cool. Mm-hmm. Yeah. So back to my journey. So yeah, 2004 or so, I was a social work intern here. I ended up getting hired. I thought I was going to be a clinician. I thought I wanted to be a therapist. I grew up in a house with a psychologist and a clinical social worker, right? So it just sort of, I don't know, it's what I knew, and it sort of made sense. And I thought I was going to be a therapist. So I went to University of Kansas to do the clinical track, and I ended up here at MHA in my first internship. And the advocacy work and sort of like the systems level work and the program development work got me more excited than the clinical work. Mm-hmm. I sort of came to realize that being a therapist takes a really deep well of sort of like emotional capital, emotional reserves, right? And I know that I have it, right? I think that I'm one of those people that would get burned out, and then boundaries would start to get weird, and just would be bad for me. So it wasn't a fit for me, but it was fine because advocacy was exciting to me. So I worked here for 10 years, worked my way from social work baby up to senior director. I left MHA in, 2013 or so to go work for Wichita State University, doing their working for the Community Engagement Institute, which is sort of like a technical assistance and capacity building center. I was on their behavioral health team. And so I was traveling around Kansas, helping folks grow peer support programs. I hope we'll talk about that a little bit. And eventually I was also I got myself involved in children's behavioral health stuff too. So we had a grant at the time called the Systems of Care Grant, and it was all about trying to create services for kids that kids wanted. I say kids, young adults, that they wanted from mental health centers. So again, it was things like peer support. It was parent peer support. It was kind of a little bit like community organizing. There's a program in Kansas called Y-Link, where kids, young people, can create their own sort of like club for behavioral health issues, resources, and socialize and do that kind of thing. So that was sort of tangentially connected. And it was really good, exciting, interesting work. And then I had an opportunity to join the dark side. So I went and did that. I went to work for a health insurance company in managed care. And I had no idea what I didn't know about how the care system works. I will admit that I went into that job pretty biased and skeptical. I told somebody at the time, this is terrible, that I sort of felt like window dressing, like they were going to do all these terrible things. And I was just there to like be the social worker that
right.
And I was wrong about that. Every person that I worked with at that company was like authentically in it for our members. Bottom.
There are good people in the dark side.
Yep, absolutely. And I am so grateful that they're there, because that system can be, we see the headlines, we experience ourselves with our own health insurance. It can be incredibly problematic.
Oh, right. Yeah.
Company that I work for
having advocates within that system is vital. A good friend of mine actually works for one of those, and she's a social worker. She and I, we went to our undergraduate program together, and she's worked for years in the dark side, quote unquote. And I've heard a little bit about her work, and she's committed very much to her members. She does true core social work in that scenario.
Absolutely.
So tell me a little bit more, even though I know obviously about what Mental Health America of the Heartland does. Tell me more about, like, how does Mental Health America of the Heartland create freedom through education and services?
Okay, can I do a little bit of history lesson? Is that cool?
Sure. Sure. I think you know where you're going. Yeah.
Again, we're going to talk about peer support a little bit. So Mental Health America, this mental health movement, right, originated with one of the early versions of this organization at a national level. It was started by a guy named Clifford Beers, who was a young man who came from a well-to-do family. This is turn of the century-ish. And I don't know what it was, but he had some pretty significant behavioral health challenges. Despite being from this well-to-do family, despite graduating from Yale, he ended up in a sanitarium. And at the time, those places were ugly, 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 ugly places.
Mm-hmm.
And he came out of that inspired to address it, which was a little bit revolutionary, right? Like, not only was somebody calling out the mistreatment of folks with mental health issues, but it was a person with mental health issues himself who was doing it. So he wrote this book called A Mind That Found Itself. So sort of like early self-help, very early peer support, at an early political movement. And he founded this thing, now called Mental Health America, in about 1909, I think. I just saw you put up a link so that people can
I did.
tell me out if I get it wrong, please do. But I think it was about 1909. Created this movement. He got psychiatrists on board at the time, and it just grew, and it's been this organization with national reach that has a really heavy advocacy focus, for like 125 years. My affiliate, my chapter here in Kansas City, Mental Health America, the Heartland, it can date its origin almost to the same time. We came to be in about 1918 under a different name. At the time, we were the Kansas City Mental Hygiene Society. I think that's what Clifford Beers called his early organization too. Mental hygiene was the word at the time. Yep. So we were the Kansas City mental hygiene, not mental health. That word didn't enter yet. Kansas City Mental Hygiene Society, and that organization evolved over the years. Did a lot of things, and one of the things, speaking of advocacy, one of the things we don't always do very well as helpers is that we are good at advocating for other people. We're not always good at advocating for ourselves, right? So Mental Health America is a great example of this. People don't know it, but we are the oldest mental health organization here in Kansas City. A lot of the larger mental health organizations that exist now were actually incubated here at Mental Health America, the Heartland. That includes mental health centers, children's programs. There's a place called Spofford House, which is a very, very famous historical site here in Kansas City. That was a Mental Health America baby. So all kinds of things. But over the years, we've consistently been very, very
told me something I didn't know about. That's cool.
Yeah.
And just to circle back briefly of something you when talking about Clifford Beers and talking about national MHA, Mental Health America, as a national organization. So we have people watching, from all over the country and hopefully all over the world. If any part of the world you're in, if you look up Mental Health America, there is likely a chapter of Mental Health America in your area. And as a national organization, it was really cool. While I was an intern, if I'm not mistaken, I went with the director of Mental Health America, the Heartland. She and I went to Washington, D.C. to do some advocacy and to go to the national conference. And you have not had chills run through your bones until you hear the bell of Mental Health America ring. And you hadn't told this part of the story, but let me, I'll tell this part, and hopefully I do it justice. Sue, don't kill me if I don't. Is that basically, Clifford Beers was he had been in and out of psychiatric facilities himself. He saw, and this was at the turn of the century when, things like shackles and chains were not uncommon. You're talking about, they called places sanitariums, and they'd basically lock mentally people who were having mental health challenges. They'd be locked up and they'd be chained. And one of the things they did with the within the organization was have people send in all of the chains and the shackles and the things from all of those places. And they melted those down and had them forged into a bell. And the bell is not unlike the Liberty Bell. And it's not lost on me that we're talking about freedom. And I've got the Liberty Bell on one side and we've got the Mental Health America bell on the other. And I was standing right there in DC and they ring that bell in person. And to this day, I still, when I think about it and when I talk about it, I get chills because it just, you can hear You can feel the pain of all the people who were shackled with those chains, and you can hear it. You can feel it in your body. The frequency of it, you can feel in your body. And it just, if that doesn't bring the thing to the surface, I'm not sure what does. And so I'm looking at people, Dr. CK's in the house, C3 Global Agency, talk about doing some great world work. She says that's powerful. And Ollie, gut wrenching. Yeah, gut wrenching, but also, the chills are not just from the negative side. The chills are from the look what we did with the chains that bound us. And then it became the mission of the organization. And as a board member, and as a previous intern, and as someone, that's where the rubber meets the road for me, is one of the actions I take for advocacy is being that board member, is volunteering that time. So anyway, the background of the agency is literally tied to the chains that bound people in those in those previous, but I also I did not realize that the mental health hygiene, I forgot that was part of Kansas City's history.
Mhm.
And I kind of like love the fact that the word hygiene was used, and now I'm trying to use the word wellness, because I think hygiene and wellness are more related than the word illness, or like mental deficiencies, or even, don't get me started today, because we don't have a show long enough. I have mixed feelings about the phrase neurodivergent.
Interesting.
Because to me, there are 8.2 the short version is there are 8.2 billion people on this planet, and there are 8.2 billion different neurodivergencies.
Oh yeah,
And
so yeah, you're right. It implies kind of like a baseline that everybody diverges
sometimes
from.
when you apply a label that you think
Mhm.
is making you different so that you can get recognition of your differences, it actually waters down things, and it actually comes back and makes people point their finger at you for the neurodivergent, or because they think there's something called neurotypical. And to be honest, neurotypical is neurodivergence.
Yep.
And so that's the short version of my mixed feelings on that, because I don't want people to I don't want people who are challenged with their neurodivergency to not get help, because they are putting themselves in that spot of, I'm being different. But then what it does is put them in the place of being treated inappropriately. So
Yep.
I hope
And language matters. Language absolutely matters.
Yeah.
Yeah, I agree with you. I think what I hear you saying is that, the word mental hygiene isn't so bad. And I agree. I think a day could come when that's the word we use again. I don't
We could
know.
bring the word back. Yeah. So
Yeah.
instead of just reclaiming nuts, we're going to reclaim hygiene. There is a hashtag born every week on this show.
I don't know if it's still true, but a few years ago, New York City still called their department for mental health mental hygiene. I was out there doing a trip with some peers looking at peer respite programs, and we can talk about that. And we met with some folks with the city, and yeah, their office was the Office of Mental Hygiene, or some such.
So
and I was surprised by that.
let's go down that road just for a second. Let's talk about the different, so just like briefly overview of the biggest programs things you see as the biggest and or most influential programs that Mental Health America has.
So are you talking about local MHA?
Local. Yeah. That's where that's where the
here at
rubber's meeting the road there.
We have 3 core, I think, program areas, and they all connect together pretty well. There's some good synergy, but the first is mental health promotion. That looks like continuing education for professionals, general education for the community, not unlike what we're doing right now. We do things like just distribute resources at health fairs and that sort of thing, mental health promotion. We have a housing department. We own properties. and manage housing vouchers for folks. All of our housing programs are supportive housing, so they are for folks that are living with pretty significant mental wellness challenges, and would have a tough time getting by in housing that's entirely independent. So we've got 4 of those programs. The other sort of core thing that we do is peer support of various kinds. So peer support is what it sounds like. It's folks who share some lived experience. They use that lived experience of recovery to serve other folks who may not be so far along in their recoveries. It's a really, really valuable approach because honestly, peers have more street cred, right, with each other than like a more traditional clinician would have.
Oh, absolutely.
So yeah, peer support folks are really, really good at in keeping people engaged, sharing resources that are meaningful to them at the right time, and they do it based on their own successes in the world. I should say when I use the word recovery, I think that causes confusion. People use that in a lot of ways, right?
That's another word that has become ubiquitous and thusly watered down, and also maybe attacked.
Yeah.
So
Yes.
All of the things. Yeah.
Yeah. We use it for political things like when an economy recovers. There's recovery acts from time to time where they're putting money out in the world. Recovery often means the early one, right? It's recovery from a physical health issue. Substance abuse issues. Recovery is a very, very significant word with that community. It's also a word that we use in the more strict sort of behavioral health arena, right? So folks with mental illness. I'm sorry I used that word. I'm not a big fan of it, but
that's all right.
Yeah.
It's okay.
Here at MHA, our folks are mostly people with lived experience from mental health challenges, but we also welcome and appreciate the experiences of folks who've recovered from substance abuse issues and all kinds of social problems, right? We've got some folks, I don't know if this is true right now, but historically we have had folks with histories of homelessness. That's another sort of experience that people have that's really valuable. So anyway, we hire these folks, we get them certified and trained. There's an official recognized certification training for folks. I think in all 50 states at this point. Looks a little different, but they're real trainings. They're legit. They're pretty intense. We get people hired, we get them trained, we get them out in the world doing good work. And that's part of
that wellness.
Yep.
It's like the step. So the first step of wellness is getting yourself well and kind of stable. The second part of that wellness might be things like a supported housing program. A third step might be being a peer staff member, helping your peers with things. And like that could even just skyrocket. I'm sure that there are individuals who have gone from there and had added different education and gone into more of a clinical or advocacy education, a higher education about that thing and continued their journey. I mean, to be honest, even though I am yes, I'm a mental health professional myself as a clinician, I'm also a lived experience person. I lived with generalized anxiety disorder until November 17th, 2022, when this is the first time I remember describing it this way, was earlier this year when I said my anxiety disorder went into remission. I have never had that experience as a clinician or I hadn't had it as an individual. And my anxiety disorder's in remission now. I can't remember what it was like to have anxiety all the time. Now I do have it once in a while, but very, very rarely. I've had like 5 different situations where I couldn't deal with it otherwise. And that's kind of a whole different story. It's another level of recovery, I think. So, it is a recovery from something that pulled me down. And, I had recovery first, and now I describe what I have as remission. Because it's not a pervasive part of my life anymore.
Yeah, actually, that's a great way to look at it. And I think people also get confused about the word recovery because they think sometimes that it means cure. That's not necessarily what though that is possible. That's not what we're always talking about. When I talk about recovery, what I really mean is that folks have control of their own lives again. folks can live with all of the challenges that come with it and still be happy and healthy and contribute to their communities and to their families. That's what recovery means to me. And so remission might be a good way to
Well, I
frame that.
wonder. I wonder. It's probably a continuum. As I'm thinking about it, that recovery is that first step. It's the recovery from the initial thing that knocks you on your butt, and it's recovery of your freedom.
Mhm.
Recovery
Absolutely.
of your ability to be an independent individual and have
Yep.
freedom to do that. Whereas then I see remission as like an additional step where it's really freedom of from the day-to-day symptomology, because even with that recovery, you still have symptomology pervasive
Yep.
through your life.
Right.
We have a question from the audience, and I love this. I'd like to hear from both of you. If you could pick two things in the world of mental wellness that really need advocacy, what would you say those are? I'm going to let Simon take this one first.
Well, my problem is limiting it to two. Okay. Two
Well,
things. There's a lot of work to be done here.
let's call them the top two. That way you can still have the
Top
rest.
two. Okay.
Yeah.
Okay. I want one more qualifier. We live in very, very challenging times. I think that what we focus on may change as things evolve politically in this country. But here's where I'm at right now. Top two things. One is we have got to recognize that mental health stuff doesn't happen in a vacuum, right? It isn't just that somebody has this diagnosis and that's all that matters. It happens in communities. The challenges happen in communities and recovery happens in communities. Folks can't really truly, in my opinion, recover if they don't have all the resources that they need to live happy, healthy lives, right? So that includes things like housing that they can afford, groceries that they can afford, access to transportation that they can afford. It's not just about somebody experiencing schizophrenia, right? It's about that person with that profound challenge, living in the community, having to navigate in the world just like us, and not having the resources that they need to do that. That doesn't affect just folks with mental health issues, obviously, right? But they bear the brunt of that. They're far more likely to live in poverty. They die 20 years earlier because they don't have access to healthy foods. They don't have what they need to be
more
well.
likely to be homeless too.
More likely to be homeless. Yep. In sort of the healthcare world, they're starting to recognize this as the social determinants of health. I don't like to talk about things in terms of money, especially when I think it's a moral issue, but I'm going to do it anyway because it sells. Something like 80% of health outcomes can be predicted by these social determinants. It's not just about medication. It's not just about treatment. It is really, truly about having access to affordable things that are decent.
And you want to hear that from
that will drive healthcare outcomes, and it drives healthcare costs.
So from a public health standpoint, that actually, I'll say that one of the things that we looked at in public health is that the zip code that you are born into determines more about the way your life trajectory will go in the sense of health, mental health, social justice, all the things than anything else. So if you think about the zip code you were born into, so like you can't do anything about that, and you can't as an individual when you're born do anything about that. Let me say it that way. Whereas as a community, as advocates, as action takers, as people with freedom to do those things, we actually can do something about the fact that the zip code you're born into has more to do with your future health, mental health, your wellness, mental wellness, access to anything. And that doesn't even talk about like your social economic status of the future, although it is true with that too. But that's that to me, that like impacts everything, and it describes that social determinants of health. We've got a huge comment here that I'm going to read on the screen. Is Jessica of the Breakthrough Show Network, that's what's mind-blowing to me, is we're over here diagnosing and medicating people who don't have basic needs being met. And as a community, we could be doing better, helping our
Yep.
neighbors. Like, and I'll guarantee that if anybody understands the word community in like this world, Jessica's one of the ones who, like, she has a community that she's a community builder, both online, offline, and advocacy. And I think it speaks to the fact that community should be advocacy.
Mm-hmm. Yeah. Yeah, that's a good point. So what folks can do is know, right, that anytime they are advocating for things like basic income support, housing vouchers, affordable housing, all that stuff, a clean environment, it all matters to folks it matters most to folks with these really profound mental health challenges, right? They bear the brunt. So advocate for things like that. It matters. It truly matters. And it is no less important than making sure there's a hospital in your town. People got to be able to live. The other thing that I think is important, this one might be a little complicated, is mental health parity, right? So there are laws, regulations that say that physical health care and mental health care have to be covered equally by health plans, right? So by health insurers, by including state-funded health plans like Medicaid programs. There has to be parity. They have to cover things equally. They can't create artificial barriers to getting a mental health service authorized. It still happens, unfortunately. We do not, even though we try often, we have not met the mark yet. We haven't risen to this challenge. We've got to make sure that health insurance companies and the state regulators that are behind them are actually pursuing mental health parity. Both regular people, right? You don't have to be a do-gooder like Stacy and I to work on this one. This is a real one. If you see this with your family or with yourself, make complaints. Complain to health insurance companies. Beyond that, complain to insurance regulators in your state. Every state has one. Call folks out. If you want to find out more about that, I'd be happy to share it.
Yep, that's where we bring Alice up, because Alice, Rutro, Alice is pissed. Alice, if you don't know, on this show is a character, and Alice is pissed. Alice is pissed because we should have the same coverage for our wellness in here as we have for our wellness in here. It's not a different, it's not a different system. It's not a different body. It is the person. Mental wellness is physical wellness. Physical wellness is mental wellness. It is not disconnected or distinct from each other. They are inextricably interconnected.
Yep.
And I think whenever it was, because I think at the turn of the century, we really had more of an understanding. Clifford Beers, the folks in his time had more of an understanding of what that wellness was. Wellness was hygiene overall, health hygiene, mental hygiene. It was an all encompassing. And at some point, something happened where we separated the two of those and somehow described them as separate. So I want people to think about what Alice is pissed about. I want to think about how that impacts you while we take a quick break.
Breakthroughs are about more than you might think. They're about discovering who you are, digging deep, reaching to the core of your soul. They're about healing yourself, understanding your beliefs, creating a ripple effect. And it's not just those initial moments that matter. It's about using them to bring more joy into our own lives and the lives of others. It's about having fun, letting loose, enjoying every moment life has to offer. It's about finding a safe space. It's about creating connection. Join us each and every day for exclusive programming, special events, and a community to call home, where we invite you to explore, change the way you look at and live your life, and go beyond the breakthrough. So we ask you, are you ready? We'll see you online at thebreakthroughshow.com.
I love that music and that.
That's pretty good. Yeah.
And we've got some like tons of cool commentary of Alice coming out of nowhere. So now we've got the audience angry about a bunch of people behind a desk to determine what gets covered, and that's between me and my doctor. And that's that dark side of people. Like, we've created a system where sometimes people who don't even have education background from a scientific perspective or a human perspective of what happens to somebody, just based on it. And it goes back to the almighty dollar, and without going too deep in that, that's the system we've created. And so then Alice comes out of nowhere. Alice is Jessica's homegirl. You bet she is. This is where the rubber meets the road.
Mm-hmm.
Physical wellness is mental wellness.
Yep. Absolutely. I agree.
And I love Ollie. Ollie is the king of words. Social pain is pain.
Yep.
And then
I'm thinking this is a good. Are you still using technology therapist, Stacy, as part of your?
I am not actually.
Drop that. Okay.
One of my previous selves.
Okay. Well, then I guess I'm asking the squirrel wrangler, or I'm looking for input from her. One of the things that I'm very nervous about, and I think this is also something folks can pay attention to in their local community, is the use of AI with health insurance companies. If it isn't already happening, it is going to happen. It is absolutely going to happen.
I'm sure it's already happening. So let's
go. They will use
what
algorithms to do authorizations.
Oh, they've used those for. They've already used them for years.
Yeah. I think that they will eliminate like the social work types that work. The potential for social work types that work in health insurance companies, physicians who genuinely care.
Yeah.
I may replace some of us.
I see that as it could go two different ways. So here's an advocacy point that we could do, but historically, and I'm getting an echo, I think maybe from, I'm not sure. So it's already happening of what we think of as AI now is ChatGPT and algorithms. Those algorithms things have been going on in the background for years. Even before it was machine-based, it was humans doing calculations about other humans.
Oh, absolutely. Yeah, you're right.
So really, the AI, the quote-unquote, the computer part of it is just a new tool. So if you haven't ever heard my soapbox on that, I'll refer people to a video on my YouTube, and maybe Jessica could help me find it. It's my signature talk about connections, congruencies, and change on my YouTube channel, because that will tell you about why AI is not necessarily going to take over the world, because there's humans behind the AI. But the other thing that means is the fact that there's humans behind the AI is even more impetus that we as humans take action. That if AI took over the world, it would be because a human behind the AI wanted to take over the world.
Yeah.
Right. So it's always the humans doing the good or the bad things. We have the choices to make change, positive or negative. And so you can always do good or bad with the tools, right? So I want to reframe what you said. I don't disagree, but I do want to do a yes and. The reframe is, what could we do more of as empathetic professionals if AI was taking care of the things in a good way, helping people do better with their lives? And so for one example, I still am a therapist 1 day a week, and I use AI for my notes. The platform I work in has an AI system built in. It records the session, it writes the note for me, and it writes, one, better notes than I've written in years. Two, it covers everything that the health insurance companies, their algorithm wants. So it's more likely that that person's going to have coverage for what they're doing.
Yep.
It gives me the freedom as a practitioner to actually focus my attention on my client better and do better work with them. And one of the platforms also has notes that it will send for next steps for the client.
Wow.
I have used, and it gives them great actionable things that they can do within their week between sessions. So my personal opinion as the Squirrel Wrangler, Change Navigator, and Technology Therapist. So for those of you who don't know, that's the moniker I used to use, was Technology Therapist. And the Technology Therapist is still there. It's just woven every day into the Squirrel Wrangler. It's part of my wrangling. But we, as a society, I think we need to reframe the use, how we see the tools. You can use the tool
that is fair. That's fair. And I want to say that I am pro AI.
Yeah.
What I worry about happening, though, in your case, in your example, right, Stacey, the person behind the AI is a supremely decent person. It's a social worker who's just trying to help people.
Yeah.
I worry that when it comes to medical authorizations and things like that, the person behind the AI is going to be somebody with an MBA.
Yeah.
Not a physician.
Who's there for this?
Worker.
They're there for this. And I totally agree with that. And that's where I say it's not the AI that's going to hurt people. It's the person behind the AI that can either help or harm. Because our choices, our actions are always either can either help others or harm others.
Yep.
And it's the thing.
And there's no stopping AI. There's no stopping it. It is what it is. It's
well,
here.
Yeah, so is fire to make meals. Again, that's and after the show, I will put. I'll actually either update the show notes or I'll go to the comments and put that other talk in, because I don't want to go completely down my rabbit hole, but I'll say go watch that and tell me what happened on August 1st, 1981 at 12:01 a.m. So I'll leave that little tidbit there for people. I want to transition us a little bit to asking the audience some things. I want to do kind of an exercise with the audience. Put in the comments one mental health truth that you wish everyone knew. And Simon, you and I, we kind of have already gone over this in a way, but is there one mental health truth that you wish everybody knew?
Everybody is going to experience a mental wellness challenge in their life, either directly or it's going to be a family member. I think something like 20-25% of people will personally experience that. If you add family and friends to that, it's going to be darn near 100% of folks.
Yeah. I think the statistic that I read before the pandemic was 75% of adults will experience anxiety in their lifetime. And then the pandemic hit. Yeah. And 100% of every individual on this planet had some level of anxiety about the shared experience we had as a planet. Now think about that. It was the first time in my lifetime, in my 5.6, my version 5.6, that I know of, that we experienced something from a planetary perspective. And that the thing we experienced on the planet that way was everyone had some level of anxiety, worry, or concern about the same thing at the same time. So we've got Dr. CK saying, mental health truth for my fellow strong people. It's okay to not be okay. You don't have to hide your pain. I think that's like the don't have to hide your pain. Our society is so much of, oh, what do you mean you're angry? Don't be angry. You can't be angry. And it's like, wait a minute, that's like telling somebody you can't be human. Because the reason we're on this planet as humans is to feel our emotions. What the actual? Right? I almost said it because y'all know, if you know me, you know those words come out of my mouth very easily.
I'm having a tough time too.
Jessica's, well, it's my show. I would say it, but I'm going to be a good girl for the algorithms. I'm going to be a good girl for the algorithm. One truth I wish everyone knew is because they don't see something with their physical eyes or even a symptom of it does not mean it does not exist. I'm going to call that one another. We're full of mic drops today. That is a mic drop. Yeah, Ollie, definitely. We need to normal. Oh, Ollie. Yep. Yes. Yep. We need to normalize to ask for help and also to set boundaries. Educate to say no, to protect. Educate that saying no is not a bad thing. There are times where it's okay to say no, especially when it means you're protecting yourself or you're protecting a loved one or you're protecting the 8.2 other billion people on the planet. What I call 8.2 billion minus one, because I'm the one in that equation. But I'm protecting the other 8.2 billion. So 8.2 billion minus one, educate to say no and protect our physical and mental health. I think we caught everybody's one thing. So let's go on to the next question I have, which is identify one, and this one you don't have to share, but I want you to really think about this. If you're watching this on the replay, if you're in the audience, if you're anywhere hearing this message, identify one person that you could share these truths that we've been talking about today with, that you could share with them within a week. Identify just one person. Because if you're watching and you identify one person and you could share this show with them so that they could watch it and learn these truths, not truths, I'm not going to say that. Learn these things, learn these subjects, learn about them, think about them.
Yep. Absolutely.
Who would you share it with?
And that is advocacy.
And that, all right, I'm going to call that for you of the biggest mic drop. And that is
you're very generous with mic drops.
But Simon is here. Simon, thank you so much. I so appreciate you having been here. I think there's so much information that we really only touched the surface of things. So I'm actually going to say, would you consider coming back maybe in the future? And let's maybe we'll do a deep dive into a particular topic or something. I would love that. I want
to sneak one last thing in here.
Absolutely.
About stigma.
You have to.
So we absolutely need to address stigma. That is real. I'm going to exaggerate for effect a little bit here, but I don't care as much about stigma as I do the fruits of it. And the fruits of it are discrimination, right? That is what we're talking about. When we talk about stigma, I worry about stigma when people internalize it. That's something that I feel like I can do something about. If somebody else carries around these ideas about folks with mental health challenges, I don't care as long as they don't hurt people with those ideas, right? So I think it's important to talk about stigma. It's important to participate in things like awareness campaigns. It's also really important that we recognize discrimination when it's happening and we do something about that. And that's an observable thing.
Not just fruits of stigma. Let's call that. All right. The new hashtag is now. Are you ready? Stigma wine. Stigma wine is the crushing of the fruits of the stigma.
Make some juice, we ferment it. Yep.
Crush it, ferment it, and then let's drink it and celebrate our freedom. Let's celebrate advocacy. Let's celebrate each other as humans. I think that's a heck of a place for us to think on, wrap up. But before I wrap everything up, how can people support organizations like Mental Health America, the Heartland? And where can they find Mental Health America, the Heartland? What could they do? What's an action they could take to help mental health?
I hate doing this, but we're always looking for money, right? One of the things that's important about organizations like this one is that we don't do things like bill health insurance companies. We don't do things like bill Medicaid. Maybe a day comes when we have to do that. It's my hope that never is central to our work. I don't want it to be central to our work because that's when we start having conflicting interests, right? I want to be able to advocate with a pure heart about what I think is best for folks. And if my work is tied to fee-for-service contracts, it can be problematic. And at the very least, there can be a perception of a conflict of interest, right? So
absolutely,
advocacy organizations need to be as independent as they can be. That takes money. Nobody here is getting rich. But we'll use the money well to do good work.
I'll tell you, if anybody can stretch a penny, as far as humanly possible, it is Sue Lewis of Mental Health America, the Heartland. I'm just going to call you out, Sue. If anybody can pinch Lincoln until he cries and begs for mercy, it's Sue.
We are good stewards of money, and we need money that isn't tied to the people we want to be advocating, policies that we want to be advocating about. The other thing that you can do is, whether it's this Mental Health America or another one in your community, they all need volunteers. They all need folks from all different kinds of backgrounds to help provide leadership.
What does the volunteering look like? Because a lot of people think, oh, the volunteering means I have to go and do something. And I think there's multiple ways to volunteer for organizations like MH. Okay.
Yeah, and honestly, Stacey, you've probably done all of them at this point.
I may have done quite a few.
Simply sharing information on social media is useful. Coming in to help with here at Mental Health America, the Heartland, we have a program that's almost entirely volunteer run called Compassionate Ear. We get folks onto a phone system and they just take calls, non-emergency calls from folks across the country who are lonely and need somebody to talk to. So if you have an interest in doing sort of like this direct support sort of role, there's opportunities like that here and across the country.
And I think that Jessica's question speaks great to that. Can nutty people volunteer too? And
not only can they, that is almost a job requirement.
Yes.
We want people who are going to use themselves and be authentic. And for some folks, that means an honest to goodness mental health challenge. For other folks, it just means really great other life experiences. I think, Stacey, because you're an entrepreneur, you're kind of in this entrepreneurial space. I think that a lot of nonprofits, I'll speak for this one, this nonprofit, and probably others, could use more of that entrepreneurial mindset. So if there's an opportunity for you to join a board or like an advisory council for a nonprofit to help them with that kind of philosophy, that kind of culture, do it, step up.
It is a different way, like having lived in the corporate world for a long time. And then, now being on my own for the past 10 years, being completely on my own for the last 10 years. I've been entrepreneurial since I was a child, to ask many people in my family, but entrepreneurial in what brings the money into my household, let's call it that. It's a very different world. It's a different mindset. You do have to, it takes, for a lot of people, I've noticed it takes a shift in mindset. For me, it was natural. For people who it isn't, it does take a mindset shift. But I also see socially, I see us moving more and more towards what I call a gig economy. And the younger folks like Gen Xers and the millennials, not Gen Xers, Gen Zers and the millennials get it. Us Gen Xers and the baby boomers we were raised in the corporate world. Maybe that's a topic we go down one day is what those mindsets do, because those mindsets set you up for different things. And that's also kind of how we have an intergenerational clash in our overall in society right now and in the workplace, especially because of those things. And I think it makes a difference. But I totally agree. I think there are lots of things you can do. You can find out more about Mental Health America, the Heartland specifically And I'm not above saying, if you've got a couple dollars or you have somebody in your family, you want to donate something in their honor. I know that a previous board member, and I'm going to try not to cry. A previous board member who left us a year ago was very attached to this agency, to Mental Health America of the Heartland. And I know that she has left a legacy of herself in this agency. And so just one, it might be, she's part of why I'm here. And so I would be remiss if I didn't say, Lee, I miss you. Lee, I'm still doing the work. Lee, Alice is pissed and Alice is still working on things. And I know that one of her people she cherished of the social work background and world was, and I can't think of her last name, but her first name was Alice. One of Lee's heroines in the social work arena was Alice, and Alice was one of who I call the grandmothers, the suffragettes, the beginnings of the profession. And that was one of Lee's, that was one of her heroines, somebody she really, and I can't remember her last name for the life of me, the ladies, but anyway, Alice was the grandmother. Lee was my mentor. And she actually is part of how Alice got her name. So I will find it's right on the tip of my tongue, the gal's name. But one of the suffragettes, and it was my mentor's heroine. So that's part of how Alice got her name. And Alice is here, and Alice is pissed. Alice wants a drink of wine because stigma wine goes great with nuts. Simon, thank you again.
You're so welcome. Thank you for having me.
Definitely be asking you back. If you want to hang out for a couple minutes, I want to chat with you afterwards. But everybody else, have an amazing Tuesday. Find somebody that you want to share the stigma wine with, and show me your nuts.
Thank you for joining us on this nutty adventure. Remember, personal growth and wellness are journeys best taken together. Keep exploring, keep growing, and don't forget to show me your nuts next time.